Okay, good afternoon. Assalamualaikum. Uh, Welcome to another session of Zaid Ibrahim podcast. Today we have my guest today is Associate Professor Dr. Amer Siddiq. He is Associate Professor in Psychiatry, University of Malaya. He's a well-known man in his field. So we are fortunate to have him to talk about some of the issues regarding mental health and the stress of modern living, basically, and how we all can try and deal with the problem. It is getting more and more prevalent. Yeah. So welcome, Doc. Thank you for joining me.
Well, thank you for having me.
Yeah. This is good. Now, can you please just, I know you're an associate professor in a reputable university, but how long have you been in this field, and what's your grand plan?
So I think, first of all, thank you again for having me. I've got to give a good shout out to our mutual friend, Dr. Fadil, for introducing both of us.
Yeah.
An interesting psychiatrist himself, very senior. In a way, sort of a mentor that I look up to when I was a junior colleague and I heard about him. But nevertheless, he's brought me to this particular podcast that we're having at the moment. So I'm a professor, as you rightly mentioned, in University of Malaya. My particular interest is in addiction, and we've had some banters actually online. I do particular work on smoking cessation, actually, quit smoking. However, in the mental health field, I'm particularly interested in depression.
Depression,
and also in policy making. So, in my personal and professional capacity for mental health, I'm the president of a non-governmental organization called Care Warriors, which focuses on mental health awareness and also suicide prevention. And I'm also one of the council members for the Mental Health Promotion Council, Mental Health Promotion Council by the Ministry of Health, chaired by the Minister. So that's where I can, like yourself, share the voices of the people, particularly those that are struggling with mental health and mental health issues, so that the relevant stakeholders can then take hold and hopefully do something about. So that's the kind of work that I do.
Mm. You also teach at the university?
Yes, I do. As an academic, I actually teach in the university, so I teach both undergraduates and postgraduates. I also do research in psychiatry and psychiatry-relevant issues. I also run a service as a medical doctor, both in UMMC, the public side, and also UMSC, the private side. And I also, on the administrative level, am the director for the University of Malaya Community Engagement Centre. So it is a centre that connects the campus, University of Malaya, towards the community at large. And I think one of the roles that I've been personally wanting to do is also introduce mental health issues. And that's why I've been more than happy to join you today towards for the community at large.
Now, this University of Malaya Department of, I don't know, it's called Department?
The Department of Psychological Medicine.
Department of Psychological Medicine. Do you have that in most universities, or?
Yeah, so our department is one of the oldest in the country because the university is the oldest. We are also the oldest program in the country, where we started the master's program, Masters of Psychological Medicine, to produce psychiatrists for the country, which subsequently over the years has evolved, and now there's something called the conjoined board of various universities that merge in producing a standard level of standards to produce psychiatrists. So most universities with a medical school will have a department of psychiatry or psychological medicine. And this department will be responsible for teaching mental health, mental illnesses, psychiatric practice towards medical students in preparation for them to become doctors. So all medical doctors, graduates from Malaysia, will have some basics in psychiatry, often between 6 to 8 weeks in total. For some of us in the older institutions, we then are also training centers for potential psychiatrists or future psychiatrists. So we have postgraduate students that join us in our university for a period of about 4 years, sometimes a bit longer, but generally about 4 years, where they are training towards becoming a psychiatrist. So these institutions often would have a big number of psychiatrists, often with various subspecialties, because as you're training to be a psychiatrist, you need to know, for example, adult psychiatry, child psychiatry, maybe addiction psychiatry, community and rehabilitation psychiatry, old age psychiatry, which is
So
really
there are many
important.
branches, many sub.
Many branches, yeah. And these hospitals would have at least one or two subspecialists in there to train future psychiatrists for our country.
And do we have enough of those specialists?
Sadly, no. When we look at the ratio, the World Health Organization for a country often recommends 1 in 10,000. One psychiatrist for 10,000 of population. At the moment in Malaysia, I think the last estimate was 0.52 per 100,000 population. And the majority of them, of course, would be in the Klang Valley. So, our country, which is quite, not the biggest, but big enough, would have pockets of our society that would be missing out on a higher level of mental health care. In academia, they would be probably maybe, I would say maybe 20% of our psychiatrists are probably in some level of academic work, and then probably another 20% would be in private practice, and then generally the rest I think would be in public practice. So we would have most of them in public practice, but again, as I mentioned, most of them would be more concentrated around big cities, Klang Valley, Penang, Johor, for example.
Yeah, I think that's almost somewhat same kind of situation in legal practice too,
Mm-hmm.
Most of them around here, that's where the money is. I think that's what they said.
Yeah, it's probably the same situation as well.
Yeah. Okay, now I want to come back to this mental illness. I use the word mental illness generally. How many types of illness? And if you can just explain to people. And then how do I know if I have one?
Right. Okay.
I mean, I may not have a serious problem.
Yeah.
But what qualifies you to describe my condition as an illness?
Right. So I think first of all, we have to look at the concept of health, right? So the concept of health often would talk about the fact that individuals who are considered to be healthy would have good physical health, would have some level of good social well-being, and then they would have this thing called good mental health, a component of health. So if an individual does not have one of these three components, then the individual can be considered to be unhealthy. When the condition becomes an illness is when function is affected. So similarly, you might have a pain in the wrist. It means that you have a physical ailment, but it doesn't mean you have a physical illness. Once that particular symptom disallows you from actually being functional, then therefore you then have some form of illness on the physical side. Similarly, for a mental health issue, it's the same. So if you look in the definition of mental health, it's going to be when you have an absence of disease, however, you have some level of disability, particularly in managing stress really well, in being able to function in your normal capacity, being unable to reach your full potential, then there's a possible likelihood that you're struggling with some level of mental illness. However,
so there are levels of illness?
There are definitely levels of illness. Like I said, there's going to be something called mental health issues, and then you've got to have mental illnesses. So you can have, for example, abnormal stress, which is a mental health issue, but as long as you're able to function, it's not yet become a mental illness. Once the stress has moved into the area where you can't function and you develop numbers of symptoms, then more likely than not, you're going to be struggling with a mental illness. Now, the mental illnesses are varied. You've got the ones that we often talk about, say, mood disorders.
Mood disorders?
Mood disorders.
I have that.
Where it's going to be often affected with mood. So you're going to have either low mood for a period of time, or you're going to be having the opposite of low mood, for example, right? And then you've got this other condition where we call it psychotic disorders, where individuals are unable to actually evaluate what is real and unreal. In the Malay term, dia dah hilang kewarasan, the inability to actually differentiate the two. And they might have a certain number of symptoms, and the psychotic disorders are then broken down into various types. The most famous one often talked about is something called schizophrenia. Another area that is often missed in terms of a mental illness is going to be substance use, issue ketagihan. So that would be another area where it would be also classified actually as a mental health issue or mental illness per se. And then you've got other things like anxiety, which we often hear about. In children, we talk about something called ADHD, attention deficit hyperactive disorder. Autism comes under us together with our pediatric colleagues. And for the senior population, dementia, which is something that I suspect will rise over time as we age, is also considered a mental illness. However, the individuals or the medical practitioners that care for these people might be varied. You might have psychiatrists, you might have internal medicine or geriatricians, and you might have other colleagues that might be caring for that particular group of people. But generally, these are some of the types of mental illnesses that we often see. Now, in Malaysia, the most common mental illness that we often see in service, in outpatient service particularly, is going to be depression and anxiety. That's sort of the kind of
depression and
anxiety disorders, a condition where...
Can you elaborate a bit about anxiety as part? Depression means you feel down, right?
Murung. Sadness that pervasive over time, and you're unable to pick yourself up.
Yes.
Yeah.
What about anxiety?
So anxiety, the Malay one would be resah. Yeah.
Resah.
So resah atau gelisah. So these individuals would have these symptoms, often again similarly for a long period of time, and often these symptoms would limit them in being able to do things. And at the worst extreme, they won't be able to even come out their house, for example, because they're just so worried about whatever and whatever, right?
Yeah.
So even in the anxiety sphere, there are a number of conditions depending on the symptoms. So you've got the generalized anxiety disorders where you're generally just anxious all the time, and this anxiety is causing you to not be able to do things. You've also got something called panic disorder, where you would have a panic attack, but in panic disorder you have multiple panic attacks. Anxiety attacks that are unprovoked, unwanted, that suddenly hits you, and you feel that, oh my God, what happened to me there? But you have multiple attacks to the point that you start to be quite aversive towards doing things because you're not sure when the next attack will be. You've also got something called social anxiety disorder, which is another condition where some individuals, as a result of this particular health condition, are really unable to mix around. It's a bit different from shyness. It's an extreme form of shyness where it limits them in their potential. So these are some of the types of anxiety disorders that we often see. But I think what's also very important that I think friends of this particular podcast should know is that before we actually diagnose individuals with mental illnesses, we really have to make sure that we've ruled out a physical health condition that might mimic some of these conditions. And I'll give you an example.
What do you mean by that?
Like, for example, if you had a thyroid function, so the thyroid is this little vessel, in your neck, and if it's hyperactive, some of the symptoms that happens with an hyperactive thyroid would be anxiety symptoms, right? If you have an underactive thyroid, for example, then you would have symptoms almost similar to depression. You'd be slowed down, weak, tired often, feeling a bit out of sorts. So you've got to really make sure that before we, make a diagnosis of mental illness, that we've thoroughly studied these individuals and made sure that they don't have a physical illness. Similarly, for even the that psychotic disorders that we talked about just now, the ones, for example, schizophrenia. Why schizophrenia? Because as you probably or people might have heard, it's often going to be associated with hallucinations, where individuals will have perceptual disturbances even though there's no stimulus involved. So you'll see things, but it's not there. You'll hear things, but there's nobody talking to you, for example. Or you might have very extreme ideas, a delusion maybe. And often you'd behave very oddly. But there are medical conditions also, like a brain tumor that's undiagnosed, that might mimic those symptoms. You might have certain types of epilepsy that might mimic those symptoms. You might have an infection of the brain for whatever reason that might mimic those symptoms. So you really got to make sure that those are not present before those other mental illnesses are diagnosed.
Okay, Prof, we will take a short break and then we'll continue with a very interesting subject that you have raised, mental illness, and we'll start in a few minutes. Thank you.
Thank you.